So it's a complication during aneurysm treatment.
Yes, it is. Hello again.
Please consider the time because we are late. We are late already.
Yes, it is very. Okay. I will be very fast. So, this is a case of a 53 years old female, and this is the case. Large aneurysm. So we perform a DSA day 3, and this is the case. So supraclinoid aneurysm. It seemed a good candidate for flow diverter, but we have decided to put some coils to stage the treatment into two stages. So the first treatment was done with coils, and this is the final result. But a week later, we have seen this. So we have decided to don't put more coils and treat the patient with a flow diverter. This was 3 days later, so probably a little recurrence, a compaction of the coils. So we put the patient in double antiplatelet therapy. Here you can see where the microcatheter was placed to deploy the flow diverter. But Houston, we have a problem. Can you see this? Here. So I didn't reach, obviously, this part of the brain with the micro guide wire. So what happened? No issues with blood pressure, nothing of nothing. So we have antagonized the heparin. We have wait 1 minute. But here you can see more clearly the hemorrhage. Any suggestion? Any comment on this? Dodi, what do you think? It's quite strange.
It's very similar to my complication. So maybe it's an Italian complication.
Yeah, probably yes.
but I did it with a guide wire, so that was simple.
But this is very distal.
It should be nickel allergy reaction.
Nickel allergy?
Yes, this way.
Yes, but the problem is that we have not deployed the flow diverter here. Not yet.
Did you inject through the microcatheter just to see where you were?
Before?
Yeah, before.
No. No, this was the only injection in the ICA.
Does the patient have any MRI?
MRI?
Yeah.
For what? No, we don't have.
Because these distals are usually related to something like ZMR. Any other vascular if you didn't reach the end, unfortunately.
Good point, thank you. No, unfortunately, we did not have any MRI, but what we did obviously was to occlude the vessel because the patient was in double antiplatelet therapy. So I occlude the vessel with glue.
What kind of glue did you use?
What kind of glue?
What kind of glue? Which one?
The
Lubran.
Glubran, yes.
Glubran.
Yes, here was the injection is 2/3 Glubran, 1/3 Lipidol. Just to occlude the ruptured point. So this is the final run. So the no more hemorrhage. Here again, here you can see there is a small hole that due to the occlusion of the vessel. So this was the CT post-procedure. Obviously, we had a subarachnoid hemorrhage, and here you can see also the occlusion with the glue. CT the next day. So not bad. The patient was recovered in the ICU, and she was intubated. And this is the CT day after. So at the time I was called by the anesthesiologist, and he told me that the patient was had a couple of cardiac problems. So we did this CT, and we have seen that there was probably an increase in intracranial hypertension. So we decided to do DSA, but unfortunately this was the result. So the patient died, and I really don't know why.
Interesting.
Any suggestion?
One more enigma.
One more enigma, yes.
One more enigma.
In your case and his case before, I've seen a couple of cases like those in my experience, and usually in both cases there was a problem of drug dose. So it was the nurse that instead of injecting 1 ml of heparin, injected 10 mL of heparin. And of course nobody knew about it. So, and that's another possibility, that you don't know that it happened, because you don't know that somebody gave more drug. You say 30 milligrams, and then it's 300, but you think it's been 30 milligrams. And that's something that I'm sure it happened in at least 2 cases. I don't know if you can think about something like this. So did you give heparin?
Yes, we did.
Yeah. So if there was a mistake in the amount of heparin, maybe it was diluted when it shouldn't be, maybe it was not diluted when it should be, and all these kinds of things, and you give this responsibility to somebody else, of course.
Do you check routinely activated clotting time, or yeah?
Do you?
Do you check?
No, not me.
And what is your dosage? What is your protocol? 70 units or 100 per kilo? What is the protocol?
Normally we put 5,000 units per liter
So
in the flash.
in the
But
flash.
what we did, we studied the ATP activation in the platelet. There is a very not expensive test that can test if the drugs works or not, and till now we are very happy. But I would like to return to your point, Dodi. You right, but here the problem. How many cases we have seen of complication during flow diverter with an hemorrhage? But in the 99% of the cases, they recover for this hemorrhage. Yeah. In this case, that was strange that in 24 hours, 36 hours.
She had a malignant evolution.
Yeah, probably.
Yeah, with brain edema and
I
brain
thought a
swelling.
vasospasm, maybe.
It was all over.
Yeah, all over.
Diffuse. This is more a neurosurgical event.
Okay.
If I have time, I have a very
Probably-
quick another case. I have a lot of complication cases, but
We,
no.
in
okay.
fact, we have several more presentations, so it's better. Thank you. Thank you
Thank
so
you.
much.